Hello everyone, today we are going to discuss health insurance. So let's get started. Health insurance definition, how it works. What is health insurance? Health insurance is a contract between a company and a customer. The company agrees to pay all or some of the insured person's healthcare cost in return for payments of a monthly premium. The contract is usually a 1 year agreement during which the insurer will be responsible for paying specific expenses related to illness, injury, pregnancy, or preventative care. Health insurance agreements in the US generally come with expectations to coverage, including a deductible that requires the consumers to pay certain healthcare costs out of pocket up to maximum amount before the company coverage begins. One of more co-payment that requires the consumers to pay a set share of the cost of for specific services or procedures. Key takeaway: health insurance pay most medical and surgical expenses and preventative care costs insured by the insured person in return for a monthly premium payment. Generally, the higher the monthly premium is, the lower the out of pocket costs are the insured. Virtually all insurance plans have deductibles and co-pays, but these out of pocket expenses are now kept by federal law. Since 2010, the Affordable Care Act has prohibited insurance companies from denying coverage to patients with pre-existing condition and has allowed children to remain on their parents' insurance plans until they reach the age of 26. Medicare, Medicare, and the Children's Health Insurance Program (CHIP) and federal health insurance plans that extend coverage to older, disabled, and low income people. How health insurance works. In the United States, health insurance is strictly to navigate. It is a business with a number of regional and national competitors whose coverage, pricing, and availability vary from state to state and even by country. About half of the population has health insurance coverage as an employment benefit with premium partly covered by the employer. The cost of the employer is tax deductible to the payer and the benefits to the employer are tax free with certain expectations for as corporation employees. Self employed people, freelancers, and gig workers can buy insurance directly on their own. The Affordable Care Act of 2010, commonly called Obamacare, mandated and the certain of national database called Health Care Government, which allows individuals to search the standard plans from private insurance that are available where they live. The cost of coverage are subsidized are for taxpayers whose income are between 100% and 400% of the federal poverty threshold. Some, but not all states, created their own versions of healthcare government that are tailored to their residents, people over the age of 65, and those with disabilities and stage renal disease or ASL qualified to receive federally subsidized care through Medicare, while families whose incomes are near the poverty level are eligible for subsidized Medicaid coverage. Type of health insurance. Health insurance can be tricky to navigate in the US. So-called managed care insurance plans require policyholders to get their care from a network of designated healthcare providers. If patient seeks care outside the network, they must pay a higher percentage of the cost. The insurer may even refuse payments outright. The services obtains out of network. Many managed care plans, for example, health maintenance organization and point of services plans, require patients to choose a primary care physician who oversees the patient's care, makes recommendations about treatment, and provides referral for medical specializations. Preferred provider organizations, by contrast, do not require referrals but do set lower rates for using in-network practitioners and services. Insurance company may deny coverage for certain services that were obtained without authorization. They may refuse payment for name brand drugs if a generic version of comparable medication is available at a lower cost. All these rules should be stated in the material provided by the insurance company. It is worth checking with the company directly before insuring a major expenses. What are compay, detectable, and co-insurance? Most health insurance plans require their customers to pick up from some of the cost of their coverage in various ways. The deductible is the amount that the customer must pay out of pocket every year before the insurer being to meet the cost. This is now capped by federal law. Copay are set fees the subscribers must pay the specific services such as doctor visits, the participation drugs, even after the deductible is met. Co-insurance is the percentage of healthcare cost that is the insured must pay even after they have met the deductible, but only until they reach the out of pocket maximum of for the year.